The Asian American Pacific Islander Nurses Association of Nevada presents Healthy Mondays with AAPINA of Nevada. Start the week healthy and right with interesting conversations on living a healthy lifestyle. And now, your Healthy Mondays host, Dr. Mary Faye Axon Armstrong.
Aloha! Welcome to Healthy Mondays with AAPINA of Nevada. I'm yours truly, Dr. Mary Faye Axon Armstrong, founding president of the AAPINA of Nevada, also professor at Roseman University College of Nursing. Wow, here we are again, Healthy Mondays. I just want to do a recap from last week. I had Professor Randall Sasa from New York City, and also Annalyn Apparente Patag, who is my childhood friend, and also now my nursing colleague, joined us last week from Canada. And so we talked about their perspective and their insights about what's going on with this global pandemic with COVID-19. And you heard the main in summary that we need to take good care of ourselves. We need to boost our immune system to fight this unforgiving, horrible virus that's affecting us globally. And also, as a reminder, as Professor Sasa pointed out, we need to be cognizant of the information we're getting on social media. You need to be able to discern and be wise to choose and pick which one is the truth, and you need to do your own research. And as Annie, my childhood friend, is pointing out, we need to take good care of ourselves, mind, body, and spirit. So tonight, I have a special guest. All of my guests are special. We haven't really seen each other face to face, but he was referred to us from one of our AAPINA of Nevada Student Nurse Association member, Jamie. And apparently Jamie works for him. And welcome, Dr. John Florendo.
Thank you. Thank you for having me.
Yeah, so Dr. John Florendo is with Unlimited Wellness Institute. So I'm going to allow him to speak about his clinic and what he does and how long he's been in the industry.
Great. Thank you. Thank you for having me. And yes, I have a fantastic team at the Unlimited Wellness Institute, and Jamie Garcia is one of my main team members. And we've been in practice for 35 years. I've been in Las Vegas since 2003. But I've had clinics in New York and New Jersey, and we've been. I'm the foremost brain chiropractic physician in the world, and with the years of experience and a million spines examined and checked, there's been all kinds of different types of problems that we've taken care of at the office. But this COVID-19 is really new for everybody.
Yes. Well, you mentioned that you are here in Las Vegas. So,
Yes.
And also the name of your clinic is very catching, Unlimited Wellness Institute.
Yes.
So tell us about the Unlimited Wellness Institute as far as specific services that you are providing to the community.
Well, we're my specialty in the chiropractic field is in the neurology of the brain, mainly by balancing neurotransmitter function, CSF, and of course cranial structural positioning. That's really one of the major areas that I focus on. And as we're getting into this type of health pandemic that's going on there, we're all concerned about, of course, our immune system. And you talked about that earlier. Enhancing the immune system. I mean, we're developing vaccines and different plasma treatments, but the main thing is that a virus or bacteria or pathogen needs a host. And when the host's immune system is compromised, that's usually when it can wreak havoc within the body. So our major premise at the office, not only is it for symptom management, pain management, things of that nature, but it's also to enhance the nervous system. And the technique that I developed, the Florendo synchronized healing method, is really a combination of osteopathy, chiropractic, neurology, especially brain, and enhancing that portion of the nervous system, which controls the immune system. So if we have a optimum functioning nervous system, we're going to have a strong immune system, and that's really what we really focus on at my clinic. So, and again, a lot of different things that we do: oxygen therapy, glutathione therapy, as well as specific adjustments, manipulations of the spine. And helping the body's functioning optimally as possible.
Yeah, we don't want the COVID-19 to take advantage of our immune
Right.
system. So we have to, as I was talking in previous broadcast that I have is with Dr. Manas Mandal. He's an immunologist, and we were talking about we need to uh, we need to boost up our soldiers. You know, the white blood
Yes.
cells are our
Yes.
soldiers,
Yes.
and
Yes. Yes. Yeah.
we want them to fight for us. And in order
Sure.
for them to fight for us, we have to nourish our soldiers,
Correct.
right?
Correct. Correct.
So we talked
So
about
what
vitamin
control
C.
the vitamin C is important. You know, there's
Mhm.
I have a website that I developed during this time. It's called COVID-19-101.com. It kind of goes over all the different things you can do for yourself. You know, suggestions for prevention is really how I termed it. And yes, nutrition is important. You know, the strength of the cells has a lot to do with our internal structure, our internal metabolic, our connection, our chemistry within. And you talked about the different fighters for the body, right? The white blood cells, right? You have your neutrophils, you have your monocytes, you have your eosinophils, you have your basal cells, you have basophils, you have all these different fighters that are coordinated by the cytokines, right? You know, the cytokines are the controllers, the protein controllers of what's going to come and help the body's resistance. And that actually, that's what they're linking a lot to the problems with COVID, right? They don't really die from the COVID. People don't pass away from the COVID. They pass away from complications. That's the whole thing, is that when they, when they do pass on, they're linking their symptom or their problem that the COVID caused is the cause of death, right? But if we go further, we know that it's not that, but the cytokine surge or the storm that they talk about is because the body can't shut down, right? The body starts to actually attack its own cells. It starts to almost an autoimmune response, pretty much, and that's really what they really pass on from is from that reaction that the body has to itself, right? So our goal, right? So if we boost up our nervous system, and on my website, on that COVID-19-101.com website, it kind of goes over what you could do. Neurostimulation, stretches are important. Of course, the breathing key, right? Hydration key. All these things that help your nervous system function optimally is going to be the way that we can strengthen from within. I'm looking at as an inside-out practitioner, not an outside-in practitioner. So I'm looking at what we can do from within to help us, and you could do, of course, herbal supplementation. You've talked about vitamin C. Vitamin C has been an antibacterial, antiviral way. Also, I have a product that I endorse that's called silvercillin. You've heard of colloidal silver, right? This is 10 times stronger than colloidal silver. Silvercillin is you also get the benefits of silver, which is an antimicrobial, antiviral component to help the body that can travel through the system, help the red blood cells, enhance red blood cell immunity. By these silver particles are small, they're nanoparticles. They penetrate the red blood cell. They help the immune system. They bring an anti-agent to help fight. And also the main thing about this type of virus is that it replicates, right? So silvercillin, the studies of silvercillin says that it stops that viral replication. So you have something so if you really do the research, which is what I do, research, write, and teach. Exactly. If you research the things that are out there, you can find them. You can find them. You have to be in tune to your body and know exactly what your body needs, right? That's pretty much what we do.
Yeah. I know what I'm picking up is as you were talking about all of this science, scientific terms, you're talking about the protein, and what I pick up about that is prevention is the key.
Key.
So yes, prevention is the key, and then you were talking about the protein, and all this, my mind is going into visually looking at in the cellular level how the protein is responsible for the synthesis, the
Yes.
protein synthesis, and so
Yes.
we don't want the COVID-19 virus to break that protein, that chain. I'm
Right.
thinking about it that our cells in the cellular level are protein,
Right.
and all of our essential essential chemicals, your
yes,
connectors are
yeah,
all like linking, and
yeah,
what COVID-19 virus is doing is trying to break it, and then they
correct,
will replicate themselves. So
correct,
what we wanted to do is to not allow the COVID virus to take away our
correct,
main protein
correct,
and
correct.
replicate it to something else and do an autoimmune or uh, destroying our own cells.
Sure.
So I'm really prevention is the key.
Key. I
Yeah.
have a saying: prevention is the best cure. Prevention is the best cure. Right.
Yes.
Yeah. So
Yes.
if you go from within and boost up what you can, and not a lot of people out there. I've taken care of millions of spines and over the years, and it's
Mhm.
just about, we don't get a manual, we don't get a body manual of how to take care of ourselves. We don't, like, not like a car, right? We have a manual to take care of a car, because everyone's
Mhm.
different, everyone's put together different, everyone has, their cellular makeup is, it may be in total the same, but how it functions depending on what's happened to them previously, depends on if they've been on if they've been injured, if they've been on different types of medication. I mean, there's all kinds of different variables that sometimes throw off how the body functions. And the goal is try to get it as close to 100% as possible. With some people that have already, had something taken out, like their appendix, or they've had surgery, they replaced the vertebra, or things of that nature. They may not be able to get to 100%. But if we can get them to 90%, I think that would be beneficial.
Yes. What Dr. Florendo, our listeners out there, what he's talking about is the term we call comorbidities. So everybody's different because we all experience different things in our lives.
Right.
Some of us may have diabetes. Filipinos, where high prevalence
Correct.
of diabetes and high cholesterol. Some of our kababayans have kidney problems.
Sure.
Some of us has congestive heart failure, and those who are really high risk are those who have respiratory problems, like
Correct.
what we call chronic obstructive pulmonary diseases, emphysema, those who already have
Asthma.
asthma. Yes,
Asthmatics,
yes.
yeah, definitely.
Mhm.
They're, as they've been reporting, a lot of the pulmonary bronchial issue patients, the complications that they have because of the heavy mucus production from COVID-19 starts to affect first that area, and then of course, as talked about, that cytokine surge or storm, it starts to actually doesn't turn off, and the body keeps on replicating these viral cells and starts attacking other parts of the body, and then we have a true problem. True, all these fires start showing up in the body, and the body doesn't know which way to go first, and that's what fatigues it. And of course we all need energy for the body to function, and I talk about in my I call it a healthcare class, really. Every 2 weeks at my office we call it a HEAL session, health education awareness lesson, and it teaches the 5 components of really health. Right? We need nervous system functioning. We need it optimally functioning. You need rest, right?
Mhm.
You need water. You need food, and you need a positive mental attitude. Right? Your mind controls your body. So
Mhm.
if you're not optimizing your mental capacity as well, which is it's kind of tough now where everyone is at home, and
Yeah.
we're in lockdown. I call it like the ballpark Frank reaction, where everyone's trying to get out, but there's nowhere to go. Right?
Mhm.
So they have to mentally help themselves. So that's really going to be the key.
Yeah, they call it something fever, cabin fever.
Cabin fever, yes.
Yes, you get a cabin fever and no way around it. I mean,
There's no way
you
around it.
have, yes,
Yeah,
it's
yeah, no,
not a high temperature, but it's like, I gotta go somewhere. I gotta get out of
exactly.
here.
Yeah, exactly. My wife and I, we were talking about this. Like, wow, we realized that you start. I think this pandemic is also a way to reflect on what's important in our lives.
Hmm.
Reflect on. I always talk about in my classes the hierarchy of values. Right, our values are determined by what we think is important at that time, and they change
Hmm.
over the years. After
Yes.
being in practice, and I'm pushing 60, and I've seen that. So your values dictate what you're going to concentrate on. And now what we're seeing is that family, is important. Yes, health is important. And I always say that your top three values. If health isn't in the top three, someone's going to get sick. For the universe to show you got to take care of your health, right? Now we're seeing that with people that are out there. Yeah, health is a high value. Family is a high value, right? Your values really start to kind of now get focused on because we're in our cabin.
Mm-hmm. And I mean, when you're talking about the needs, the hierarchy of needs, it brought to me about Maslow's hierarchy of needs. The basic needs that we need to survive: food,
right,
clothing, shelter. But
right.
we often forget about the belongingness. A lot of our nursing students are cooped up in their apartment or house, and they're trying to study.
Sure.
And now they don't see their classmates. They use the socialization is very important, and then now they tell us do social distancing. It's like can't touch anybody.
Those are some high values in some people.
Some people.
Social reaction is a high value for people, and you're right. So they have to kind of reshuffle, but in the end, really what drops out is what truly is valuable to you.
It's individual. If it's valuable to you to have a private time, we really need. Sometimes I just want to be by myself. I just want to be alone. And I think that it's good for those people. I'm personally half homebody, so I can transition and adapt to having to go out and meet people, or I can be at home. I go to work, go to school, and then come home and I'm by myself. Nobody's around me. Nobody's in my in my personal space. Now those people who like their personal space 6 to 8 feet, you got it. Looking at the positive. Looking at the positive view of this and COVID.
That's so true, because I always have a saying is that crisis is a blessing. And we look back and we reflect. If you think back at things that really upset you in the past, they like, oh, I can't. And then you look back and say, wow, I can't believe I really got that upset over that. Really, you learn from it, or you look at it as more of a comedy. Or our tragedies become comedy over time, and we look at it as a lesson and a blessing to be able to understand. What I always look at, what's the best thing that happened in this bad thing that's occurring. The bad situation, and if you look hard enough, you'll find it. You'll look hard enough. Like look what they've came about with what's happened. Everything shuts down, right? But the environment changed. The air is cleaner. The dolphins and the fish are coming out, and the pollution's decreasing. So you have to kind of look at the two sides of the coin. Right? It's not always one way. We become so blinded and narrow-minded. But if you really look at the other side, there's a blessing, and environment's changing. We're getting closer to the people that we care about, even though it may be on video. But we're able to. I talk to my parents like every day. They won't let me near them, but it's okay. We have FaceTime, right?
Don't visit us. but I just wanted to ask you, Dr. Florendo, before we were told to stay home and do the social distancing, what type of clients do you have in your clinic? That I think I wanted to focus on the Asian Pacific Islander population. What type of problems are they having before this and COVID?
Yeah, well, as you mentioned, a lot of our patients they have either type 2 diabetes, or they have heart disease. They have definitely circulatory problems and things of that nature, which leads to migraine headaches and balance and vision and things on the 12 cranial nerves and CSF and neurotransmitters, and we're helpful with what we do with helping reduce the amount of pressure on the spine. 1, 2, helping increase circulation. 3, helping to balance neurotransmitter functioning, supplementation wise. For the testing that we do is for transmitter, how balanced your neurotransmitters are, and the studies are showing is that your nervous system controls your immune system, by the neuroendocrine system, right? So your sympathetic chain, you have your two types of nervous system, your sympathetic, parasympathetic. Your sympathetic chain is actually wrapped in a neurotransmitter, norepinephrine, right? Norepinephrine is wrapped around the sympathetic nerves, right? So, we can control how the body functions by, making sure that the nervous system's firing properly without any interference. And really what traditional chiropractic is that we're looking for nerves that have been irritated because the spinal structure losing its normal positioning. And by correcting or adjusting that position, we're helping to help the nervous system function better, which in turn helps all the other 9 systems function better, right? Your nervous system is your master control system, and really helping that. So our patients have, of course, they have symptoms of pain or numbness or tingling or headaches or dizziness or blurred vision or those types of symptoms that we can help with our particular technique at the office. And so before COVID, we had a lot of those circulatory problems, and helping the body heal faster by removing interference when they have type 2 diabetes or they have high blood pressure. We're just helping the body function better, optimally, get it to function optimally better, and that way their health is better as well.
Yeah, I can see your role as I know when I was in training, undergrad and even a graduate level nursing, we had to take this complementary alternative medicine, and we had to learn about the chakras. And I can see there was one point where we talked about that if there is the clog in one of your system, either it is the I know that our lymphatic system brings everything. And if there is a clog in any of our lymphatic system, any of the system, then it's the blood flow and oxygenation is not going where it needs to be. And so the spinal manipulation and massage, those are ways that we can open up that clogged, that's clogged
lymphatic system.
It's just like the plumbing. It's like it's a plumbing in the house.
That's your sewage system.
Yes.
Your lymphatic system is your sewage system, right? So you want to make sure that you have the proper nerve stimulation to the glands that clean the lymphatic system, right? And all your little nodes that hook into the big glands. We want to make sure that there's a clean, flow, so your body can work the way it should, and detox the way it should. Now, that's why the CSF is that's my forte. We developed an upright MRI to see CSF flow in a person's brain, and they've been linking decrease in CSF flow to a lot of Alzheimer's, dementia, things of that nature, and you'll see that with, of course, a lot of trauma to the cranium, like football players, soccer players, car accidents. So we're in the process of patenting an upright MRI so we can see the flow of CSF. And with my technique, the Florendo synchronized healing method actually helps increase CSF flow, right? So we can get in there, help the CSF, and help the body balance, because CSF is a detoxification. It not only is it nutrients for the nervous system, a detoxification, and a protective covering, of course, of the brain. So we really want to help the body function from the top down, right? That's why we're working up top down.
So the CSF, for those listeners who are not familiar with it, it's the cerebrospinal fluid.
Correct.
So it is what you can find, like if they say, I need a tap, they're going to pull out CSF from my spinal area. That's the cerebral spinal fluid that flows from our brain and then into our spinal fluid area and then go back. So if it's contaminated or it has infection in it, then most likely your brain's area is going to be affected. So there's so many scientific information that we're giving you today. So thank you, Dr. Florendo. The other question, I'm getting all excited because you're bringing back all of this training that I had during undergrad and graduate level, which I take for granted, like, I do know what he's talking about. So I mean, in your setting right now, what are the significant changes that you are experiencing right now, running your clinic with all of the wonderful services that you're providing to our community? How are you
Well,
coping with this?
yeah, well, we're considered essential. The governor has termed us essential, so we really have to take precautions. Like I mentioned earlier, that silvercillin product, we spray silvercillin. All my team members, we spray silvercillin on our faces, in our hands before I go in and take care of a patient. Patients wear masks while they're on the table as well, and we, of course, after they're done with their care, their therapy, we disinfect the table, and of course the social distancing. We really have to schedule our patients accordingly. We don't have more than 3 people in the waiting room, and we don't have any more than 3 in our treatment area, and so that's kind of thrown off our schedule, because we've also reduced our office hours as a result of being helping to save being exposed, and so we're at the office only a couple hours 3 days a week, but you know what, I tell you, people, they find a way to get there, and they want their care, and we'll text them or let them know. We'll have them wait in the car if we're overrun for schedule time. We'll text them, say, stay in your car, and as soon as you'll see someone exit, then you can come in. So yeah, so it's been it's kind of like what I saw at Best Buy yesterday, right? No one can go in the store. You drive up, you have a person greeting you, and okay, go take this parking lot, and we'll come out for your return or whatever you purchase online. So it's changed a lot of our organization, but like I said, I feel it's a good reflection of what we can do for efficiency wise and safety wise too. So but we've been working it the whole time, and love what you do and do what you love. You find a way to get there.
Yeah, this COVID-19 is not going to stop us from doing what we love to do.
Yeah, that's right.
Our passion to help other people, and also it cannot stop people. I can see here from my window, people are still walking and exercising.
Yes.
And they are observing the social distancing. I can see sometimes, oh, I saw this one yesterday. So every day this one is running or walking with their family.
They're improving their health, and because health now became a high value to people. And same thing with me in my neighborhood. I see people walking. They're walking their dog. They're jogging, and they're doing their spatial thing. Everyone kind of waves at each other, in their distance apart. But I think we'll be better off after all this is done, and we'll value more things that should be valuable.
And we're forced to be domesticated, and I'm starting to
My
cook.
wife cooks really good. My wife cooks really. I realize she's a great cook anyway, but I think we eat out a lot during the. We don't really buy a lot of canned food. So we stocked up a little bit on canned food, but we don't really buy a lot of canned food. Everything's fresh, and or at the restaurant or whatever. But yeah, she's cooking up some great meals, and I'm really blessed to have a good cook in my life.
We're eating healthier,
and eating healthier, freshly cooked. We go pick up veggies, and we store them in the fridge, and she breaks out all the good stuff that I love. Yeah, so it's a blessing.
Emptying what you have, and then kind of like whip up what you have to get rid of it before it goes bad, right?
Yes. Yeah, well, and organizing. I see that we've been able to organize, room by room, and and all my friends that I talked to about that, that's kind of what they said too. You know what? I've been able to just stay home, and I cleaned this room I couldn't clean for so long, and exercise at home, and save on my gym membership.
Yes, there's a lot of good things that came out of
you gotta
this.
Look from.
So positive, yes. Wow, look at that. We had already talked for about half an hour, and but I wanted to thank you, Dr. Florendo, for agreeing to be our guest tonight. But last word of encouragement, last word of wisdom to our listeners out there.
I always believe that everything happens for a reason, and yes, if you look at the history, we've had pandemics every 100 years, and we've overcome them. We've been able to be well during that time, but life is precious as we're looking at it now. And, I do a lot of reading, and one of the presidents of the SGI, Soka Gakkai International, which is Nichiren Daishonin Buddhism, he said that, there's nothing more important than life, nothing more precious than life. And I think we're seeing that now with what's going on in the world today.
Yes, life is so precious and you only have one life to
Correct.
live. Yes. So I wanted to have you repeat the website that you were
Yes.
talking about earlier.
Sure. The COVID information site is called COVID19-101.com. And I go into what we talked about today and a little bit more in regards to how we can increase our oxygen intake, how we can help stimulate the nervous system while you're at home. You can do that as well. And my website, drflorendo.com, has some great information. drflorendo.com also has great information as well. And then you can always, if you have any questions, please email me at unlimitedwellness@gmail.com. unlimitedwellness@gmail.com. And I'd be happy to respond if I know the answer. If I don't know the answer, I'll research it.
Great. Thank you so much, Dr. Florendo, for joining us tonight. Thank you, PHLV Radio, for your partnership. I hope that you will come back again to be our guest.
Be my pleasure.
I'll
Thank
reach
you for
out to
having
you. Well,
yes. Have a great day.
Listeners, remember, every Monday is a Healthy Monday. Aloha.
Aloha. Bye-bye.
The Asian American Pacific Islander Nurses Association of Nevada has just brought you Healthy Mondays with AAPINA of Nevada.